We heard some inspiring words from our colleagues in Rwanda and Myanmar, and they both addressed the role of civil society, and I think that's something that is critically important, as we've heard several times today. So just a brief introduction for those of you who are not familiar with the World Hepatitis Alliance. It is a global patient-led and patient-driven organization with representation in now 89 countries. We're very pleased to have just welcomed 3 new member organizations from Tanzania, Georgia, and Armenia. So we are growing our membership. And the work of the World Hepatitis Alliance really started about 10 years ago when there was a huge gap in global advocacy around hepatitis. We had seen what had been done with global HIV advocacy, and there were groups working at national and subnational levels, but there was no global voice for viral hepatitis advocacy. The Alliance was formed in 2007, and much of what you heard John Ward speak about earlier today, the work of WHO in really addressing viral hepatitis in the last 10 years was driven in large part by the civil society actors with the World Hepatitis Alliance. From the World Hepatitis Day resolution that really created World Hepatitis Day as recognized by WHO, one of only 4 disease-specific days recognized by WHO, to the resolution that asked WHO to explore the feasibility of the elimination of viral hepatitis, to the global health sector strategy that was approved 2.5 years ago that set the targets for the elimination of viral hepatitis as a public health threat by 2030. Civil society, led by the World Hepatitis Alliance, was very involved in all of those discussions and in the drafting of many of those resolutions. We've got great treatment, curative therapy for hepatitis C now, really a revolution in medicine, the first ever cure for a chronic viral infection. We have good treatment for hepatitis B, but we don't have the people who are living with these conditions diagnosed. And as you can see, we've got targets for the elimination of viral hepatitis by 2030 set by WHO. There are interim targets for 2020. And for those interim targets, we're actually doing a little bit better. There are 38 countries on target to hit those interim targets for diagnosis by 2020. And that is a 30% of those living with hepatitis B and hepatitis C diagnosed by 2020. Fewer countries, only 21, are on target for that 30% diagnosis rate by 2020 for hepatitis B. Those numbers are, as you know, much smaller for the 2030 targets. And where are people getting diagnosed? Well, in the Americas, in Europe, we've done an okay job of getting people tested and diagnosed for hepatitis C. But in the global south, there really has been a lot of difficulty getting people diagnosed, and there are many reasons for that, and that's what we're going to be talking about in just a moment. So, looking at the fact that, as Dr. Kin mentioned, 9 out of 10 people living with viral hepatitis globally remain undiagnosed, the World Hepatitis Alliance decided to launch a 3-year campaign called Finding the Missing Millions on World Hepatitis Day of this year. 290 million people living with hepatitis B or hepatitis C unaware of their affection. And the focus of the Alliance's work is really to get civil society in the center of these efforts. Margaret mentioned it earlier today. The role of the affected population is critically important in actually making an impact. We've seen that with HIV, we've seen it with other disease states, we've seen it with cancer. We're trying to build that momentum within the affected communities for hepatitis B and hepatitis C. And those are very disparate communities. Hepatitis C has its communities that are affected. Hepatitis B has its. There are generalized epidemics in some countries. Other countries, it's more related to specific subpopulations. And so the first part of this Finding the Missing Millions campaign was a global survey sent to 3,000 of our members, partners, WHO, regional offices, and looking at the barriers that these partners and members saw to diagnosis in their countries. We had about 600 of those surveys returned, and after we processed that and reviewed the results, we convened a stakeholder meeting in London in May of this year to really go over and refine what the barriers according to this survey were, and launched on World Hepatitis Day a white paper that spoke to the barriers and how they might be addressed. And none of these will come as a surprise to any of you. I think what was a surprise to some of us was the lack of political will not being mentioned by as many groups as one of the top barriers. Of course, just access to diagnostics in some countries is difficult. And we know that there is a lot of work that still needs to be done around the simplification of diagnostics, but these were the top 5 barriers that were identified by the survey respondents. And I think special attention should be paid to the role that stigma plays in the reluctance on the part of some to even get tested in the first place. In places like China, getting a diagnosis for hepatitis B will lead to the exclusion of certain kinds of work for people living with hepatitis B. And so stigma cannot be overstated, and the effects of stigma cannot be overstated. So overcoming the barriers. And out of the stakeholder meeting, some of the people at that meeting are here in the room today. We came up with 3 main goals to work with our members and ministries of health to overcome barriers to diagnosis and diagnostics. Raising awareness. Clearly, the level of awareness varies from country to country. I think in a place like the US, there's a relatively high level of awareness of hepatitis C, but not hepatitis B. Where does the awareness from hepatitis C come from? Well, probably from direct-to-consumer marketing for hepatitis C drugs and disease state awareness marketing from the companies that have these drugs. So that's one scenario not applicable to most of the world. Raising awareness in most of the world is going to have to come from the public health infrastructure and the government. And again, we come back to political will that does not really exist in much of the world. Making testing more accessible. So what needs to be done there? Well, again, going back to the simplification of diagnostics and lowering the cost of diagnostics. That's a very simple and easy barrier that reduces the likelihood that someone is going to get tested for hepatitis B or hepatitis C. Also, including hepatitis services into universal health coverage. And we're beginning to see that a little bit in some countries. We worked in Nigeria last year, for example, on building an investment case for hepatitis C. And as a result of that, and working with the Ministry of Health, hepatitis B and hepatitis C services are now included in the universal health coverage scheme. Now, that only covers 5% of the population, but it is a start, and it is a step in the right direction. Removing cost barriers for viral hepatitis testing, again, that goes back to the same simplification of testing and really, as much as possible, embedding these hepatitis services into universal health coverage. The second phase of this Finding the Missing Millions 3-year plan is working in country with 5 member groups and really helping them design and implement an advocacy strategy. The applications will be out next month for member organizations to apply. We're still working on the criteria that would be used to judge the applications. I think one of them is going to include access to treatment, ideally. You know, we want to be able to get people tested and diagnosed and linked to treatment. And in some parts of the world still, access to treatment is problematic. Another part of this phase is going to include an online resource where any organization will be able to use these tools to better advocate within their public health infrastructure. So we're going to hear in a moment from Dr. El Sayed from Egypt, and it really can't be overstated how important it is to get civil society engaged in these efforts. We've heard a little bit about what's happening in Egypt. We're going to hear a lot more in a few minutes. This is a picture of an organization that is working on a program called Hep C Free Village. And it is a civil service organization, the Association of Liver Patient Care. And they are going from village to village and screening everyone and linking them to care. And to date, and Manal will correct me, it might be updated as the number of people screened seems to be updated daily, close to 40 villages have been screened in their entirety, tested and linked to care, and many of them cured. And we heard this in the HIV community, nothing about us without us. Really, these decisions have to include the affected populations. I myself am a former hepatitis C patient. I had hepatitis C for about 20 years. I was treated and cured in a clinical trial about 10 years ago for telaprevir. For those of you familiar with telaprevir, I accept your empathy. But we really, really need to focus on getting the affected populations, wherever they are, whoever they are, engaged in these conversations. And in that spirit, I'm going to give the last word to a peer outreach worker with whom we work in Seattle, Washington. His name is Z, and he's going to tell you a couple of words about his story.
My name is Zakat, as I hear everybody calls me. You see some other things too, but me going into that, okay? Anyway, somebody said, hey, you want to get tested? Sure. I think the motivation at that moment was, we'll give you a $10 gift certificate. You can go to Safeway and do whatever. Sure. Then they come back and tell me, I've got Hep C. I'm thinking my world just fell apart. But they say, hey, we got a cure. Get out of here. $1,000 a pill. Anyway, I did the whole thing and went back after it was on. They say I'm cured. I'm cured and I'm spreading the message, spreading the word. You can get cured. You can get help. I'm right there, man. I am the front line for you guys. I'm right there.
Well, thank you, Z. I think as we do a better job getting the easier to reach people tested, treated, and cured for Hep C, tested and linked to care for hepatitis B, we're really going to need to engage some of the affected populations to get to some of those people who we otherwise aren't going to reach. Z goes out every week to places where we can't get to, and he reaches people who otherwise are not going to be getting the services that they need to at least address their viral hepatitis. Many of them have competing priorities, but with the technology that we have to easily cure hepatitis C now, that's certainly one thing that we can address relatively easily. And with that, we're going to invite Dr. Manal El Said up to tell us some of the great work that she's doing in Egypt.